Furosemide
Lasix.
by Kayla Basner and Haley Hanzar.
Haley, I think we're going to start you on furosemide for your hypertension.
Furosemide? What's that? I've never heard of it.
You may have heard of it by its most common brand name, Lasix, or you might have heard of it as like a water pill.
Oh, I think I might have heard of that. I think my aunt took it for heart failure though.
That makes sense. Lasix is a diuretic and it can treat hypertension as well as edema associated with congestive heart failure, acute pulmonary edema, liver and renal disease, glaucoma, and acute congestive heart failure.
Oh, okay. Well, how much do I have to take?
Well, since the recommended dose is about 20 to 80 milligrams a day, we're probably going to start you out on 20 milligrams.
I remember when my aunt was on Lasix, she had to eat a lot of bananas, but I never knew why.
Well, diet is very important when you're on Lasix. You need to watch your potassium levels, so eat foods rich in potassium like bananas, prunes, raisins, and oranges. We're also going to need to check your blood pressure regularly, and occasionally you need to get blood tests because we have to watch for symptoms related to imbalances in electrolytes and fluids like hypokalemia, alkalosis, and hypocalcemia. Also, remember to exercise, drink about 2,000 milliliters of water a day, and eat a low sodium diet. So, your loop diuretic can cause ototoxicity, so we're going to send you to get a hearing test.
My loop what?
Loop diuretic, that's the kind of diuretic Lasix is.
Let's talk more about the pathophysiology of diuretics. Diuretic drugs increase urine output by the kidney by altering how the kidney handles sodium. If the kidney excretes more sodium, then water excretion will also increase. Most diuretics produce diuresis by inhibiting the reabsorption of sodium at different segments of the renal tubular system. This picture shows how loop diuretics inhibit the sodium-potassium chloride pump in the ascending loop of Henle. This transporter normally reabsorbs about 25% of the sodium load. Blocking this pump leads to a decrease in reabsorption of sodium and chloride and less water reabsorption. Lasix is the most common loop diuretic because it is less powerful and has a large margin of safety. It is primarily excreted through the urine. Do not take Lasix with aminoglycosides or cisplatin because of increased risk of ototoxicity. Patients taking high doses of salicylates with Lasix may experience salicylate toxicity at lower doses. Indomethacillin and NSAIDs also reduce diuretic effects. Tell your doctor about all medications you use, including prescription over-the-counter vitamin and herbal products. Side effects include dizziness, lightheadedness, headache, blurred vision, and signs of dehydration. Tell your doctor right away if you have any serious side effects, including muscle cramps, weakness, severe dizziness, fainting, unusual dry mouth or thirst, fast or irregular heartbeat, unusual decrease in the amount of urine, numbness, tingling, pain, redness or swelling, hearing changes, stomach or abdominal pain, or yellowing of the eyes or skin. Get medical help right away if you notice any symptoms of a serious allergic reaction, including skin reactions, severe dizziness, and trouble breathing. Contraindications include allergy, electrolyte depletion, problems urinating, severe renal failure, hepatic coma, or if you're pregnant or lactating. This drug is in pregnancy category C. Be cautious when taking Lasix if you have SLE, gout, diabetes mellitus, or lupus. To assess response of the drug, check your blood pressure regularly. Tell your doctor if your condition does not improve or if it worsens. For example, your blood pressure readings remain high or increase. Every patient should know to protect this medication from light. If you miss a dose, take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Avoid getting up too fast from sitting or lying positions, or you may feel dizzy. Get up slowly and steady yourself to prevent a fall. Avoid becoming dehydrated and monitor INO, blood pressure, and electrolytes. Take in the morning to avoid peeing all night and work it into your schedule. You may be peeing 6 to 8 times an hour. Ask your doctor if you have any other questions.